Earlier this summer, Governor Charlie Baker approved a pilot program meant to treat opioid addiction in some county jails, including 3 here in western Massachusetts. Through the program, doctors will prescribe opioids like Suboxone to former opioid abusers. Advocates say medication-assisted treatment is key to those inmates trying to kick their opioid habit. But as the Berkshire Eagle first reported, at least one sheriff believes that approach won't help inmates get clean and sober. I spoke with Berkshire County Sheriff Thomas Bowler about his perspective.
Among the sheriff's office, or among the 14 sheriffs, we decided on 5 venues or 5 sheriff's offices to be a part of the program. We already have Franklin County Sheriff Donelon, who's been doing this. Hampden County has started with Sheriff Kochi, and Sheriff Cahalan wanted to be involved. So we already had 3 individuals from the Western Mass area. So I chose to stay out of it for the time being and allow Middlesex County Sheriff Peter Katusian to be involved, as well as Sheriff Bellotti with Norfolk
Well, what
County.
are your doubts about the use of medication-assisted treatment in a jail setting?
Okay. We have a tremendous amount of data dating back to the 1930s, the late 1930s, with AA. And then later on...
Alcoholics Anonymous.
Yes, Alcoholics Anonymous. And then we had NA, Narcotics Anonymous. Tremendous amount of data dating back for years where millions of lives have been saved because of abstinence, okay? We've been advocating at our jail for the 8 years that I've been there, doing the same thing, clean, sober living. There isn't a tremendous amount of data out there supporting medical-assisted treatment, and you have to keep one thing in mind. Inmates that are coming into our facilities are addicted to heroin and other illegal substances. It's an opiate. My philosophy is we're taking and we're substituting that opiate with another opiate to curb their urges and their cravings.
Be it the Suboxone that's prescribed or something like that.
That's correct. Now, we also offer Vivitrol, which is the blocking mechanism for those opiates when they leave our facility.
That lasts for about a month,
It's right? A month, about 30 days. So we've always been advocating the clean, sober living. We've been very successful at it. We want to continue doing that. Now, I think it's a huge step in the right direction for these 5 sheriffs to have this pilot program, and it's going to allow us to gather data for the future to see what the most effective or the most efficient way to treat addicted inmates coming into our facilities that are addicted to opiates.
And so then it's a 3-year pilot program for those 5 houses of corrections that are going to take part. And it seems like you're already talking with them, and there's an ongoing dialogue. Will you be reviewing the data from that pilot program?
Absolutely. That data will be available to all of us.
And if you see that the medication-assisted treatment is that best practice, would you be open to trying it?
Absolutely. Absolutely. Medical-assisted treatment has its place in our society. There's no doubt about it. One thing you have to keep in mind, when the legislation was originally starting to do this, I felt a lot of it was being shoved down our throats, okay, as a mandate.
Because initially it was going to be system-wide.
That's correct. And when you take a look at the system, why would we want to give Suboxone to inmates in like our Department of Corrections that are doing 5, 10, 15, 20, 25 years, okay, depending on whatever crime they committed? They're in a clean, sober living environment. If security measures are up to snuff and up to date, where we can keep the illegal drugs out of those facilities, which is a constant task for all of us in these secure facilities. But you have a chance to get those who are addicted, and keep one thing in mind, those who go to state prison are already with us for a period of time. So they've been clean and sober, and they've been away from the drugs. And now you're going to put them back in the system and keep them there and keep giving them the Suboxone and methadone? It doesn't make any sense to me.
What happens to people who come into the system currently and have a prescription for this type of medication? Do they just stop? They go cold turkey, or how are they treated?
We do.
And how do they respond? Can't they get sick?
They do get sick, but we give them other medications, non-addicting medications, to ease their tensions, to make sure to control their seizures if there are any. We use a clinical opiate scale addiction scale that we monitor with our full medical staff that we have and our mental health team. If they rate high on the scale, then we'll bring them to the hospital and make sure that they're treated. But we'll give them medications to curb their urges and to curb their the cravings that they have and keep them on constant monitoring. We have a full medical team, and we assess every individual that comes into our facility. We do 3 assessments: a full medical screening on these individuals, a mental health screening, and also a security screening. So we're gathering a tremendous amount of data from them, and they're open and upfront with us.
Speaking of that data, there was some Department of Public Health data that really jumped out to me. The Berkshire Eagle first reported this when you talked with them about your position on medication-assisted treatment. And that DPH data is as follows: that opioid overdose death rate is 120 times higher for drug users who have been incarcerated. Why do you think that is?
Well, it also depends on the time frame that they've been incarcerated. There's been talk of legislators that say that with the Suboxone and methadone in our facilities, that it's going to curb, it's going to knock down the recidivism rate. It's going to keep people from reoffending. 88.8% of the inmates that came into our facility since January 1st of this year are also using other illegal substances as well.
Because you know that they're drug tested when they come into the system?
They're drug tested, they're openly telling us this. They're very upfront with it, okay? And when you have somebody that's there for the 3rd or 4th or 5th time, then something's not right. Obviously, whatever they're doing, the outpatient counseling isn't working, the diversion programs, maybe it's the drug court, that's not working. If you send them to us for 6 months, 8 months, or to a year, we're able to break up that cycle that they're in. Okay, break up the process, get them thinking clearly. It takes about 50 days to get someone who's heavily addicted to opiates, about 50 days to start really feeling good about themselves and thinking clearly, get their self-esteem back up and their self-confidence, and then start with their counseling and therapy programs.
You know, one of the things that you've advocated for since you've been sheriff is to have counselors who follow these inmates once they leave, and you've requested money for that. Do you know where that stands?
Aftercare is huge. Aftercare is huge whether you have someone who's addicted, has an addicted personality, or has an addiction when they leave our facility, or even those who are just trying to be reintegrated back into the community without an addiction. These individuals are with us because of the structured lifestyle that they have, which wasn't good to begin with. Now that we've had them with us for a period of time, and keeping them in that structured lifestyle and keeping them on that positive road of doing well in the community, aftercare is huge. I have advocated. I'm a firm believer that aftercare is one of the most vital components to reintegration. And as long as you have, I've advocated for 4 caseworkers. I call them street workers. I have case managers inside my facility. We all do, all the sheriffs do. These are the individuals that prepare our inmates for reintegration back into the community. Once they go out, that negative influence that got them in trouble in the first place is going to be slapping them in the face. You need to have structure in place for aftercare when they're outside as well. And having those 4 case managers or street workers would be so vital and a huge component for us.
Sheriff Buller, one more question for you. You've been sheriff there for almost a decade. You were a longtime member of the Pittsfield Police Department. You've been entrenched in the Berkshire County community for a while. How have you seen the opioid crisis impact your community?
I've seen it go from years ago. We started, just a little background, back in the Berkshires in the late 80s, early 90s is when crack was introduced to Berkshire County. That time, that hit a variety of individuals at different ages, different cultures, different groups, socioeconomic classes. This is doing the same thing, but also at a younger age, a much younger age than the crack addiction was.